My name is Sherry Guess, and this is the Heavily Metalled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thanks for coming back to this edition of the Heavily Metalled Podcast. You guys are going to be super excited today. We have Dr. Mitch Reiter joining us from New Jersey. Dr. Reiter is the inventor of the Sensiband device that tests for metal allergies, and I am super excited to have him here today to answer your questions, to talk to us about Sensiband and more. Thanks for coming on, Dr. Reiter. Welcome, welcome.
Thanks so much for having me. I appreciate it.
Tell us a little bit about your background and what got you interested in metal hypersensitivity.
So I'm an orthopedic surgeon. I'm a spine specialist within orthopedic surgery, but I'm a medical doctor. Metal allergies, the way I got started with them is I have 4 children, 3 of whom are very nut allergic. And when I was first in my residency and fellowship, I started seeing patients who weren't having optimal outcomes from surgeries, like hip replacements and knee replacements and spinal surgeries. And I started to put together the fact that allergies are just much more common nowadays. Everyone knows that. And autoimmune disease is seeing more of it. We're seeing nut allergies and gluten allergies and just so much more lupus and everything. Mm-hmm. And a lot of people know they're allergic to metal. They can't wear certain jewelry. They just know that they react to metal. Yet we are putting metal in people all of the time in our surgeries. And not all these patients are doing great. Some of them, after knee replacement or hip replacement, have swelling or pain at the site, or sometimes muscle aches, or more generalized symptoms of just like achiness and fatigue and malaise. They're inflamed and they're just having a bad outcome. And nobody is getting tested before we put these metals in people. So that's that, in combination with the fact that my partner and co-inventor, Dr. Mark Drzala, he reacted to the metal amalgams, the fillings in his mouth from the mercury. He had not just toxicity, but an allergy to the mercury. So the two of us started brainstorming and saying, what's going on? I mean, people are reacting to these metals. They're having suboptimal surgical outcomes. And what's happening is patients would go back to their doctors and say, hey, my knee replacement still hurts, or my hip replacement still hurts. And they get a little bit blown off. The doctor would do an x-ray and say, hey, it looks good. Maybe you have fibromyalgia, or you're depressed. Or they jokingly say, hey, it sucks to get old. So they were not really worked up or further evaluated. And even a couple percentage of people that get a hip or knee replacement, it will actually become loose and fail. It's called aseptic loosening. And there's no reason for that. And we suspect that some of those are allergic reactions. So we started putting all this together, and that's what got me initially interested in the metal allergy.
You just hit the nail on the head, and I'll even blow your mind even further. I've got people that have had open heart surgery reacting to their stainless steel wire in their sternums.
That's actually very common.
It runs the gamut. What kind of training do you get in medical school regarding hypersensitivity to metals and potential reactions to implanted hardware?
The sad answer is none. Like, we're not really taught about metal allergies at all. It's the cutting edge. I can tell you that in 2019, the head of the FDA, Scott Gottlieb, actually put out a call to action saying that biologic reactions to implanted metals and other implants are a problem. And we need to learn more about it and figure out what we can do. So he identified this, saying that in medicine, we are not on top of this problem. We need to start to figure out some answers. But there is no formal training on metal allergies. It's not well understood, and there's no perfect answer. So I'm going to tell you what I think, and I'm going to try and constantly qualify that and say that we're not sure, because we're all learning and we're trying to figure out what's the best way to help our patients.
And a lot of times that's thinking outside the box. Why do you think so many providers are closed-minded to the idea of metal hypersensitivity? Because I've run into it. I'm sure you've run into it. Why?
Yeah, that's a great question. It's a little bit sad in the fact that doctors are very busy, especially surgeons, and they're running from patient to patient. It's a long conversation to start talking about metal allergies. It's not a 2-minute conversation. and they just don't have the time for it. They're told by the implant industry, we don't think this is an issue. It reminds me of cigarette companies many years ago when they said they didn't see smoking as causing cancer. They knew there was this association. Doctors are told that metal allergies are probably not a problem. Doctors don't want to do anything that might dissuade their patients from having surgery. If you have an achy knee, you're thinking about getting a knee replacement, and then the doctor says, oh, by the way, you could be allergic. Some patients might say, forget it. That's not worth it. And so it's a little bit sad that a lot of doctors just don't have the time for it. Others realize it's not a well understood area and just aren't addressing it.
Even more than that, me and my followers have had doctors that say it's not possible. It's not only is it not a thing, it's not possible.
Yeah, what's crazy about that is so these big companies make hypoallergenic implants. So they make nickel-free implants. They even make zirconium implants that are designed for people with metal allergies. But on the other hand, they'll say we don't think it's a problem. So they know it's a problem. It's one of those things where they just don't want to bring too much attention to it. It's not well understood. The analogy I use is if I was going to sell you a home directly underneath a cell phone tower, and you're going to move in with your young family, and I said, listen, I called the big carriers. They said it's okay. They don't have any data showing it's a problem. And that's where we're at. It's not well understood, but intuitively, we know people are reacting to metal on their skin. We know people are having bad outcomes, and we know some people are doing well when you take out those implants, or when you use the right implant, they do better. So it's all coming together, but we're not there yet.
And for just a doctor to say it's not possible when, to me, I'm a lay person. I was planning to go into medical school, but it seems common sense to me that you put something foreign in the body. We have a smart immune system. It's going to right away, whether it's an allergic reaction or a foreign body reaction, say, that's not supposed to be there. And it's going to mount an inflammatory response to a greater or lesser degree. That just seems like common sense to me. Yet to so many, not you, but so many in your profession, it's not even that cut and dried. And I just scratch my head.
Yeah, it's unusual to say it's not possible. You say people could argue about the incidence, but to say it's not possible, you definitely have patients, and I could tell you anecdotal stories of patients that had severe reactions. So you yourself are the poster person of somebody who really has a severe reaction to metal allergy.
Unfortunately. How prevalent do you think reactions are to surgical hardware from your own personal observation in your practice?
So I am a spine surgeon. And the good news about spinal surgery is we tend to use titanium implants because our patients need to have MRIs. So titanium metal is usually an alloy of titanium, vanadium, and aluminum, because those things are not what's called ferromagnetic. They don't cause a very blurry MRI. So fortunately, titanium is much less reactive than cobalt and chrome and nickel, molybdenum. So
stainless steel.
Really, so stainless steel is an alloy of chrome and nickel. It's very reactive. So spinal surgery, I don't see it that often, to be honest with you. Now, the straw that broke my back, I once had a patient who had a cervical fusion with a titanium plate, actually with nerves, and did great for 10 years. And then at the adjacent level, developed a disc problem, which is the downside of fusions, that you put stress on the adjacent levels.
Sure.
She failed non-operative care, and I did a disc replacement, which is a newer technology where we're not doing a fusion. It's superior, in my opinion, at the adjacent level. And for about a week, she felt awesome. The shooting pain down her arm was gone. Then she developed terrible reactions, rashes all over her body, terrible itching, just achiness. I sent her to allergists and immunologists, and ultimately skin patch testing, which was the gold standard at the time, and serum testing and LTT testing, identified a cobalt allergy. After 6 weeks, she begged me to take it out. And I thought to myself, this is the fringe of, if I'm going to go into her neck and take out a well-fixed disc replacement to convert her to a fusion, a less good operation. And I was worried, what if it's just new laundry detergent, or her neighbor had their house fumigated or something? So, but I did it. I took the disc replacement out and converted her to a fusion using the same type of titanium plate I knew she tolerated, and everything went away. She got completely better. So that was when I said, oh my God, like here's a fluoride reaction that it's rare to have that, but there are a group of people, you, that have these terrible reactions. If I had made her stay with that, she would have become bedridden and been in trouble.
And I would say I don't think it's rare. I think it's underreported because people aren't connecting the dots. I don't think it's rare. I think it's probably even more common in your practice than you realize.
Yeah, you're probably right, because there are people that have some chronic pain after surgeries, and what percentage of that due to the implants versus not, I can't tell you. We try not to have to take these implants out, but I do it sometimes. And more often than not, I'm pleasantly surprised with the results. I always warn the patients, listen, this may not do anything. But more often than not, they are very happy. So you're probably right. We just don't know. I'm a small company, the Sensiband. We're just trying to get it rolling. But once we get it going, we'd like to do these studies and invest in the research necessary that's going to push science forward. It's just these types of studies require large groups of patients and big periods of time. So they're not easy just to do off the hat.
I got large groups of patients.
Perfect.
How many of the patients that come into your clinic initially are concerned about metal hypersensitivity prior to their surgery?
So that is the problem. Almost none, because it's an awareness issue. And that's one of the struggles we're facing with Sensiband is once people see the reaction, that you go to my website, you see the reactions that happen, it's intuitive. Oh my God, I react to jewelry, or look what this is doing to my skin. I don't want that put inside my body, for God's sake. But most people don't think about that. And they trust that their doctors have their backs. And doctors are good people. They're just busy and they're told this is not a problem. And so most people don't think about it until you mention it. Then then very quickly, it doesn't take much to make people use common sense and say, whoa, oh yeah, that makes total sense, especially once they see a skin reaction. But most people are not asking ahead of time.
And the craziest thing, just to give you an idea about how these things can steamroll, and I think you and I both and all in this metal allergy industry are just at the cutting edge of this. My first viral post online went to 2 million people, and it was a post about your stainless steel water bottle could be making you sick. It was just a post I made. It was a fluff post, really. I don't really do fluff posts, but you look for stuff to talk about. And that post went immediately to 2 million people. It had, I don't know, tens of thousands of shares, 5 to 10,000 comments. And you know what they were? Me too. Me too. Me too. My lips go numb. I'm having this chronic pain. I stopped drinking out of my Yeti, my Stanley, and my pain went away. My brain fog went away. I was just like.
That's amazing. So Europe is ahead of us. Europe has the nickel directive where they try and minimize exposure to nickel. The US does not have that, but it just shows we're a little behind on the metal allergy topic.
Yeah, for sure. Okay, let's talk about Sensiband. Go ahead and give us an overview of Sensiband. Pretend my listeners know nothing and tell us about the different tests available, how it works, and what type of price point that consumers can expect when they order.
So right now, almost nobody is tested, but there are really two main ways of testing people for metal allergies. You know this, but I'm going to say it for your viewers.
Sure.
The most common way is skin patch testing. If you go to an allergist and say, I'm concerned about metal allergies, they do skin patch testing. You have to go to the doctor's office, they put that on your body, you go back in a couple of days and they look for a reaction. Sometimes they'll try and have you come back again, see if they can get it to last a few days longer. It gets messier and harder, but they can try. But it requires at least 2 doctor's visits, maybe 3. And they look for
a week of misery.
One of the problems with skin patch testing is they're testing to the metal salt, not to the actual elemental metal. There's petrolatum gels involved. There's adhesives. So it's not perfect, but it's what we have. And it's what the data is mostly based on. And that's what allergists recommend. Now, the second type of test is called lymphocyte transformation testing, where they test your metal to see if your lymphocytes proliferate in the presence of the metal. The science behind that is pretty good, but even among the LTT testing companies, they argue. Malaysia in Europe will claim they're better than the labs in the US. It's not FDA approved for metal testing. So science is not great yet. It's just another option. They claim it's a little more specific. It's another way to test people. But it's a blood test and it's multiple hundreds of dollars, not covered by insurance. So then we felt like there's a hole in the testing. Like one is like going to an allergist and all this difficulty. The other is just blood tests. It's not even. So my partner, I wanted to come up with a test that was easy to perform, simple, did not require a prescription. Because as you notice, some doctors don't believe in this. So you have to be your own advocate. Yeah. The doctors are supposed to ask you before they do an implant, do you react to metal that you wear on your skin? But most don't. So we wanted to come up with an easy test, empower the patients to test themselves. It had to be affordable so you could screen large numbers of people because millions of people get metal put in their body every year. And I don't know if we can do millions of these other elaborate tests. So we developed Sensiband. And what Sensiband is, it's a wearable device where you get a kit that contains 7 medically pure metals: cobalt, chrome, nickel, titanium, aluminum, copper. You get like these medically pure metals and you wear them like a swatch on your wrist. We recommend wearing it for a week. Most reactions we're seeing within 3 to 5 days. And people will develop what's called a type 4 hypersensitivity reaction. It's like contact dermatitis. They get a red patch directly underneath the worn metal. Mm-hmm. And it just gives you another data point that you're reacting to that metal. So I'm not saying our test is better. Nobody knows which, like the FDA said, we don't understand this. It's just another data point. that gives patients some information. I certainly think if my skin reacts to nickel badly, I don't want nickel put in me. I don't think I would say, let me go to the allergist and do skin patch testing. And if I don't react on that, then I'm okay. Or if the LTT test says I don't react, I don't know which test is better, but this is a cheap test. And the kit is $125 for all 7 metals. Now we make a dental kit for the metals that are specific to dental implants. It's a smaller kit that's $65. And then we even have a jewelry kit for people that want to know why they're reacting to jewelry. Instead of just saying, I react to cheap jewelry, they'll know I react to chrome or nickel. For example, sterling silver has copper in it. If you can figure out what jewelry you're reacting to, we're not really marketing that one heavily yet because we're trying, the medical kit is what really I think helps patients because those things are put in you forever. Piercings you can remove, the jewelry you can take off. So that's the concept. We wanted to come up with a test that was reasonably priced, that would allow people to test themselves. So they could then go to their doctor and say, hey, I am nickel allergic for sure. My skin reacts to nickel, not I have a jewelry reaction or my belt buckle. They'll know exactly what they react to, or I'm cobalt allergic. And then the doctors can use the right implant for them because there are implants that are hypoallergenic. The medical industry has addressed this problem. There are ways to treat these people. You don't lose the ability to treat them. It's just you use the correct implant for that patient. That's the long answer to how we got to there. We needed a cheaper test that was widely available. People could do themselves without needing a prescription to get some more information.
And it sounds like you're saying, I'm not against an LTT test. It's just expensive. It needs a doctor. I'm not saying I'm not against a patch test. It just provides some discomfort. And here's something you can do on your own before or after or instead of.
Exactly. Now, those tests are great. I mean, the LTT people, they are good scientists. So if you test positive to Sensiband, you can certainly go ahead with an LTT test to give yourself more information. But I don't know if I then had a negative LTT test, if I would feel comfortable saying, I guess I can put this metal in. Because that we don't know that answer yet. LTT testing is, if anything, a little oversensitive. So if you're negative on that, it's probably a good sign. But I doubt you'd be positive on our test and negative on theirs.
As they've said, it's just a snapshot of the immune system at a given place in time. So results can vary a little bit in the LTT testing, depending on the status of the immune system.
100%.
Did Sensiband undergo any kind of clinical trials? And if so, how big was the sample size and what were the results?
We are underway. We have scientific advisor, Dr. Alexander Saw. He's a joint replacement surgeon in California, one of the busiest in the country. He does over 1,000 joint replacements a year. We are doing a clinical trial now, but we didn't want to wait because it may take a long time to get that out. We didn't want to wait because Sensiband passes the smell test. If your skin is reacting to something, it's obvious. It's what allergists do. So some of the LTT people will tell you they don't think the skin it matters. But then why are allergists doing it? Allergists know what they're doing and they do skin patch testing. Additionally, if you even look at the information on the LTT company sites, they say people that are reacting to jewelry, that's when we want to do the LTT test. Like they actually care if you react to metal. So Obviously it's the same immune system. The cells do migrate. It's the same T cells, they migrate. Which test is better? We don't know yet. They're all data points that can help guide a patient make a good decision. I don't want to disparage it. Those tests are good tests. It's just this is another option. So we are doing the test. We don't have the data yet. But in medicine, there's an anecdotal story where they say, I'm not going to wear a parachute jumping out of a plane because there's no randomized controlled trial showing me that wearing a parachute increases your survival when jumping out of an airplane. Nobody's done that trial. It's a joke, but like at some point, if your skin is going crazy because you have cobalt on it, I don't know if I would say, listen, they didn't prove it. I'm still going to get cobalt put in me.
I've known doctors that have literally done their own Sensiband. They've taken a piece of the metal and taped it to their patient's skin prior to surgery and looked for reactions.
You are very knowledgeable because that is what prompted me to do this. 20 years ago, I knew a doctor who was taping screws to people. And I'm thinking to myself, what? That's so non-scientific. The other thing is when you tape the actual metal, that's an alloy. So stainless steel is an alloy of multiple elements. It's nickel and chrome and iron, or titanium is an alloy. It's better to test to the pure metal. That's been shown by the allergists in their literature. So that works. And they were doing their best. They didn't have the right testing. So they were taping the metals to people's skins. But we think it's better if you can actually tape the individual element because you'll get a better reaction and you'll actually know exactly what's causing the trouble.
And you know what's interesting to me, and this might blow your mind as well, but how many doctors that patients talk to have forgotten that even titanium's an alloy, that they are all alloys. They just don't even bring it up. And it might interest you to know. I definitely, if you don't know him, want to connect you with Dr. Scott Schroeder and Jifa Dordanu, who is a nurse educator who works for the University of Victoria in Canada. They're actually doing a clinical trial right now on explanted hardware. They're taking basically LTT and metal allergy testing results, receiving the explanted hardware, having that analyzed to here's what the manufacturer says is in the implant, here's what our tests show is in the implant, and here are the results of the patient's LTT test. Very interesting clinical trial going on there, and they are looking for explanted orthopedic hardware. So might be an interesting group for you to.
I'm glad they're doing that. It's not easy to do, as I'm sure they told
No.
you. That's great that they're pushing science forward. One of the other reasons I did this is that I was part of a large group at Rutgers Medical School where we were a level 1 trauma center. And I had several partners that were trauma orthopedic specialists, so constantly fixing broken bones. And when I became concerned about the metal allergies, I spoke with them, and they said frequently when they fix a bone with plates and screws and rods, patients would have pain over the implants. And a year after the fracture surgery, they can remove those implants if they're bothering the patient. And they said a lot of times they go in on somebody to remove the plates and screws or rod, and they see like an inflammatory reaction around the implant. And they think it's an infection. They get concerned, so they culture it and send it off to the lab, and it comes back negative. And they take the metal out and everything goes away, so they forget about it. I'm wondering how many are allergic reactions to the metals. They're seeing, they tell me they see it all the time. They see an inflammatory response around these painful implants.
And I'll give you one. Of course, I'm the unicorn, but every single implant that I have had taken out, I've had 8 removed. They have seen no inflammation around the implant.
Yeah.
0.
So, yeah, because there's 2 different ways you can react. You can locally react or systemically react. Mm-hmm. And you might be one of those people that reacts more systemically,
for sure,
as opposed to a local reaction. It's the Wild West. We don't fully understand it yet. We're trying to learn. I think it's better to err on the side of caution while we're learning. But there's so much room to improve what we can do to help our patients.
Yeah. And you're coming on the heels of my Hardware 101 episode. That episode, I literally urge surgeons and physicians to just wait a minute before you perform surgery. If you have a doubt about a patient's sensitivity, just wait a minute. Maybe put a pregnant pause in on the surgery.
100%. Now, some surgeries can't be delayed. They're urgent.
Sure.
Spinal fracture, for example. That's why people that are reactors, they tend to know they're sensitive people. A lot of them are allergic to other things. It might be smart ahead of time before you even have a surgery, know what you're allergic to. Yeah. Because, and again, getting to the edge of things, stents that are used for heart attacks, coronary stents and vascular stents contain nickel, commonly contain nickel. Now they have an option, they're titanium stents. So if you know you're nickel allergic, you might be able to steer things in the right direction. If you break your ankle, you could say, hey, don't put chrome in me. And they'll know there's an alternative. They'll know to use the titanium alloy plates, which are a little more expensive, not a lot more, but a little more expensive. But yeah, if you know you're reacting ahead of time, because once you've broken your ankle, it gets a little hard to delay surgery because you can get blood clots and other complications. So it'd be nice to know ahead of time. The VA and the Department of Defense have met with us because they're interested in maybe knowing ahead of time for their soldiers what metals they're allergic to, because if they're injured in combat, you don't have time to then test them. It'd be nice to know ahead of time, are they allergic to nickel? If you're a super reactor, get them ELISA, go to an allergist, do all 3. But for some people that are not as reactive, it might just be screening tests to do the cheapest one and see where you land. If you're positive, you can decide you want to go to the next level.
So the Sensiband device is registered with the FDA as a Class 1 medical device. Would you explain a little more about the approval process and what that means to the consumer?
Yeah, for sure. So registered with the FDA really means that we are not considered unsafe. We don't meet criteria where we would be a safety issue for the patients. And we're manufactured in a strict way that meets FDA requirements. It does not mean we have been tested. We are not FDA approved, which means we would have been tested to prove our efficacy. That would require many studies that would cost probably millions of dollars that we just are not quite able to do yet. Maybe one day we would love to do that. Sure. But so right now we know we're safe. We know we're manufactured in specific ways so that our metals are pure. But going from there, then we have to use common sense and know that if our skin reacts, it's some type of allergy.
So let's talk about the details of Sensiband. We're going to do a bit of a deep dive. And while we're talking here, I'm showing some of the pictures of the device. The discs for Sensiband are quite large. The website states that 2 can be worn at a time, but it seems like it might take a long time to test for all the metals in the kits. Have you considered putting maybe smaller discs, multiple metals on one band for greater testing efficiency?
That's a great question. I have a day job. I'm a spinal surgeon, and my partner does too. So we're doing our best to make Sensiband functional. This is the first iteration. We talked about putting multiple metals in one disc, and that was deemed not smart because it moves enough that you will get cross-contamination. We are going to make the discs a little smaller on the next generation. Right now, they're the size of a quarter. We're probably going to bring them down to the size of a nickel. We're talking with some metallurgists and allergists that getting smaller than that might not be ideal either. And the first generation, especially, we wanted the best results. We wanted proof of concept. So we wanted a big piece, big disc, You'll notice Sensiband, it's a hypoallergenic band, a silicone band, but there is a stainless steel bolt on the other side. That's not ideal. It wasn't on the
Right.
first generation, but the bands were not staying on as well as we liked. And we had to add that bolt. Now it's away from the testing site. So you would react separately to that compared to the testing site. Our next generation, we're going to probably try and move to a Velcro band with hypoallergenic silicone. There's some issues. We're working on it. So it's a project. For the current band, it works well for 98% of people. Some people say it doesn't stay on as perfectly as they want. So you have to maybe put a piece of tape or just reattach it if it opens. I'm sorry about that. We're trying our best to get this to work. The stainless steel bolt is tiny. It's away from the site of testing. We haven't seen problems from it, really, to be honest with you. That's where we're at. We're going to try and make it more aesthetic. Now, the thing is, you don't need to test every metal. Someone like you does. But really, what you want to do, you want to ask your doctor, what are you going to be putting in me? Most joint replacements, for example, are cobalt, chrome, molybdenum with some nickel contamination. So you could just test those 4. Or if you have getting a titanium implant, just test the titanium. You don't need to test the copper and aluminum if you're not getting those put inside your body. So you don't have to test every single metal, number one. We give you 2 bands. You can wear 1 on each wrist. With the next iteration, with the Velcro bands, we might provide more bands if you wanted to wear more at a time, if time matters. But this really was designed more for joint replacement patients who know months ahead of time that they're going to get a hip replacement or a knee replacement or a shoulder replacement. They could wear 2 at a time. But you could wear them. The bands are big enough. You could wear 2 bands on 1 wrist. Or my partner had a patient needs surgery very quickly. She taped the pieces to her torso and did all 7 at once. Not ideal. It's not ideal, but if you're really in a rush, you could put them on, or you could wear some around your ankle and some around your wrists. And so we're doing our best. We're trying to balance cost and convenience. If we keep getting more and more stuff, the kit price goes up, and we're trying to keep it reasonable. If we can get silicone Velcro to anneal, which we're close to having work, that might be easier. And we're trying to be cost conscious.
I'm terrified of what if I ever need a cardiac or a vascular stent. I didn't even know until today that there was a titanium option available. However, I want to get to it later in the podcast. I do react to trace nickels. I think we need a non-metal stent.
Yeah, we're not there yet, but you're right.
But if I needed a pacemaker, if I had heart trouble, there is some of that runs in my family. I have been in so much pain. It was suicidal pain. It wasn't like, oh, this is a walk in the park. I couldn't walk 5 feet. And I would rather say almost DNR me, let me die, than go through that again. I could not go back there.
Ideally, they could find a non-metallic way to help you, or you'd maybe find some immune modulating way to reduce your reaction. If you had to have something metal put in you, a way to modify how reactive you are to it. Again, this is all beyond the science.
It's actually not. I don't know if you've seen some of the episode I did with Marco Caicedo, who's the immunologist for orthopedic analysis. It's episode 15, I think. You could go back and watch that, but they're actually finding that off-label use of some of these anti-TNF blockers, these rheumatology drugs, are really helpful for people who have to have metal to calm the immune system. But it's an off-label use, trying to get it approved, trying to get it paid for. We're just not there yet. But it is.
No, I agree. I'm aware of that. That's why I didn't want to say it, because it's, again, like when I said beyond the science, we're on the off-label region. But yes, I think it's very promising. Medications, especially if they could tailor them even more specifically. So you're using it for something else to help you. Imagine if they have the monoclonal ones that are specific to metal allergies. That would really be the home run that someone like you would
get there. Medicine's amazing and it is advancing. It's just sometimes it's slow.
And it's going to help us with this. As AI
it is.
Sorts of inside all literature, it's going to help us push things like this forward.
The good, the bad, and the ugly. Okay, so talk to me about how a patient with the Sensiband tests for subsequent metal sensitivities. We've gone into a little bit of it, but we obviously can't use the same location if we're broke out from one metal. Is there a certain amount of time they should wait if they want to test it on the same location before testing a different metal?
So that's a great question. Again, you know your stuff. So if you react, you definitely have to use a new site. The question is, if you don't react, should you use a new site? My partner, he'll tell you should use a different site because there could be really rarely a delayed reaction. So if you use a metal on the same site and you react, ideally then you should wear the other metal again somewhere else and try and sort through it. It's extremely rare. We're not really seeing that. But ideally you should wear the same site. I don't know if that's absolutely necessary. I would say if you really want to be careful, use one side of your wrist for one metal, then the next week do it on the opposite side, wear it reverse so that the metal's on your inside of your wrist 1 week and the outside the other week for the different tests. Or if you want to just make the band bigger and move it up your arm and test a totally different site. But there's 2 populations. There's people like you that are just very reactive. And that's where all these details and have to really be super cautious. But most people are not like you. And we're trying to catch the big reactors in that group. And I think we haven't seen problems using the same site over and over again because people tend to react within 3 to 5 days. We're not seeing delayed reactions. So anecdotally, in hundreds of patients, but not millions or thousands, we haven't seen these delayed onset reactions.
So what is the button actually made of that fastens the silicone band? And you've mentioned that hasn't been problematic for some, but if it was, how could users get around any potential reaction to that metal?
So that button is stainless steel. There's not that much of it in contact with your skin, but the reaction we're trying to elicit is a delayed type 4 hypersensitivity reaction. And that's a cellular media reaction. And it should be just at the site of the implant. Now, there are more systemic reactions if you continue it for a prolonged period of time. If you were to react at the site of that, it's a stainless steel button, which is an alloy of nickel and chromium and iron. Then you would react at that site and you would say, okay, the stainless steel button's reacting. But then you could find out, is it nickel or is it by wearing nickel or wearing chrome? And that's where the larger surface area of the actual test is more helpful. If you're totally concerned like you could probably put a piece of tape around it and just not let that metal contact your skin.
I know some in the community will put clear nail polish. That's been helpful.
That's a great idea too. Yeah, that's good to tell people. I didn't think of that, but that makes sense too.
Okay, I noticed that some metals are not available with some of the test kits. For example, vanadium appears to only be available in the dental kit. Can individual metals be added on for an additional cost to a kit that they may not be included in?
Again, great question. You're obviously in the weeds. You understand this. So we initially wanted vanadium to be in the medical kit because titanium is an alloy of titanium, vanadium, and aluminum.
And I have vanadium reactive followers.
Yeah, it's rare, but vanadium is very expensive. And we found that including vanadium was raising the cost of the kit quite significantly. Okay. And it's much less common to be vanadium allergic than it is to be cobalt and chrome or molybdenum allergic. And a lot of people don't need to test to vanadium because they're getting cobalt, chrome, molybdenum hip replacements and knee replacements. And it's a big part of our population that is testing. It's a joint replacement community. So we made a business decision not to include vanadium in the medical kit because we were really focusing on joint replacement patients initially. We sell separately vanadium testing kits. So it's available. You can buy them. If you're someone like you who's very knowledgeable and concerned and is getting a titanium implant, you could buy vanadium separately. Now, the dental kit, because dental implants, they don't use cobalt and chrome and molybdenum. The dental implants are titanium, again, which is the alloy. We felt like we had to include vanadium in those kits because those people didn't need a test for a lot of metals. They really just need a test for our titanium and vanadium and aluminum. And we included stainless in the dental kit because braces, we've seen young people, adolescents get braces and they get rashes on their bodies and don't feel right.
Retainers.
And retainers, and people get blown off. It's really sad. The stories, I'm sure more than me, but I get told very sad stories of kids that had bad reactions, ADD type reactions, and just not feeling well, and they're blown off, and then the braces come out and they feel much better.
Let me blow your mind here. I actually spent $10,000 on a zirconia dental implant because we knew titanium was probably not a good idea. This is at the end of the metal allergy saga. It was just like a year and a half ago. And we knew ahead. I did all the research going in. All of a sudden started having trouble. The bone wouldn't graft. It wouldn't fuse, wouldn't anything. I was having all kinds of pain, couldn't chew on it. Find a journal article. That actual brand of zirconia implant had trace metal impurities in it. Nickel was one of them. Had to remove them.
Yeah, you're right. But zirconium is the right answer. My partner, who had the mercury issue, he had to have dental implants. He had to order the zirconium implants. They cost more. But his dentist now is a true believer. And, it's oral
But
surgeon.
you have to find the zirconia implant that doesn't have the trace metals because some of them do.
Yeah, that's interesting. It's very hard to get rid of those trace metals. Yeah. Now, the question is, not everyone reacts to trace amounts. We don't know what is the threshold. You're obviously...
Yeah, let's come back to that one. Let's come back to that one.
Sounds good. That was a long answer as to why we don't have vanadium in the kit. We wanted it. It's an expensive metal. It's going to make the kits cost a lot more for many people that don't even need to test for vanadium because they're not getting titanium. And we're trying to get awareness. And as the kits got more and more expensive, initially we were hoping to make them for $80, but we're losing money. We're trying to make this functional for people. Unless we can get the sale price in an area where people can do it and are willing to test themselves and think about it, we're struggling.
So what about false positives and false negatives? Have you seen any with Sensiband?
So again, now you're at the edge of the science. We're treating all positives as real positives. If patients are concerned, I'll say I'm not an allergist. I'm a spinal surgeon. If you're concerned, you can go see an allergist. We'll tell them that we'll get the LTT testing. But again, we don't know what to do with all those results. If they're positive and we're negative, do we call ours a false negative? Or if they're negative and we're positive, is ours a false positive? Like
Sure.
It's like you said, we're not quite sure what to do with these results. So nobody knows the incidence of false positive, false negatives, because what makes it a true positive? Unless you see them then react to the implant in their body, that's a true positive. But we don't want to get to that.
I have found that if the pollen is super high outside, I'm more reactive. If I'm eating foods that are high in nickel or high in histamine, I'm more reactive. So I'm sure that it changes based on the immune status at any given moment.
There's a lot that goes into it. So unfortunately, I don't have an answer about false positive negatives. We're treating all positives as potentially real. If there's an alternative implant, and in spine surgery, there isn't always, but in joint replacement, there is an alternative implant. Use the hypoallergenic implant. We just feel like it's not worth the risk to hope you have a false positive. And if you're wrong, the consequences are severe.
Okay, so many who favor lymphocyte transformation testing are concerned about patch and external testing as potentially sensitizing the body to metals. Is this a concern with Sensiband, and why or why not?
It doesn't make a great deal of sense to me, because if wearing a metal on your body for 1 week is enough to sensitize you to a metal, putting it in your body forever certainly is going to be more than that, right? I don't understand what the concern is. Like if you're going to be sensitized that quickly to a tiny amount of metal on your skin, I think you don't want to put in your body. I just don't understand that. If a week of wearing it would sensitize somebody, are they trying to say that they would have been okay if they hadn't done that? Because it's going to be in their body for years. It's more than a week. So I don't understand the logic behind that. And they don't have a good answer to the question I just gave you typically.
Point taken. Okay. How often in your practice are you seeing reactions to titanium?
Very rare. So I know you are, but we're seeing it at about 1%. It's pretty rare to be titanium, but
that's still going to be 1 out of 100 patients.
Yeah. So it's not zero. It's just much less than nickel. Nickel, we're seeing 10 to 20% of people, women 20%. Titanium is much less common, but it's not zero.
And now a word from our sponsor. Attention metalheads, are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. ELISA, a valuable diagnostic tool in medicine. How much credibility do you give to nickel allergic patients like me who seem to be reactive to trace nickel in titanium implants? And before you answer that, let me just tell you, just by way of illustration. So I mentioned to you about my Tarlov cyst surgery. My followers know about that. I went out, had Tarlov cyst surgery. They implanted microplates and little bitty screws in my pelvis. We verified with the manufacturer ahead of time there was no constitutional nickel in those implants, and yet I reacted to them. I actually had, this wasn't planned this way, but it happened this way. I had a orthopedic analysis LTT test that I had in 21. So several years ago, my nickel reactivity on the scale was a 6. I have the implants put in California for my pelvis. 2 months after, wasn't planned this way, had another orthopedic analysis test because I was doing a podcast episode and I'd had a bunch of metal removed. And that comes back a 12 instead of a 6 on the nickel reactive scale. And at that point, I didn't have any pain. So we're seeing a true delayed onset because 2 months later, I had pain, I had hair loss, I had fatigue that was just squashing me mentally. I was definitely reactive to trace nickel. I had those plates removed, like I told you at the beginning of this podcast, a month ago, and the hair loss stopped immediately. The fatigue, the pain, it all stopped. So here I was reacting to what we can only assume was trace nickel in those implants. What my pelvic implants are less than 1/10,000th of 1% nickel, but it's not zero. Wow. So what do you think about this?
Yeah, again, you're beyond the science that we have right now. There are people that are just super reactive. Now, speaking to a lot of metallurgists, it's very difficult to get nickel out of certain metals. Like it's not like they want it in there. Apparently, it's difficult from a metallurgical standpoint. I think most people do not react to trace nickel, but there are people like you that do. And we just don't know what is the threshold. What is the number that's safe? I don't think there's going to be an easy answer. Someone like you who's that reactive, you probably need to just not get implants put in your body so
It really
hard.
isn't just me. I am a unicorn, but I have a lot of followers that are really, and I'm up to 20,000 followers plus across all platforms that really are reacting to the trace nickel. So I think,
No,
again,
you're
it's a
right.
bigger problem than we think.
And I think it's going to be hard for people like you that are so super sensitive. I don't know if companies are always going to be honest with how pure they can get it. Each batch of metal is a little different, and so there are some people that are just extraordinarily reactive, and it's terrible for them when they get that metal put in their body. The cervical disc replacement I use now is pure titanium. Nobody knows there's some trace amount of nickel in it, but we don't know what number is safe. But it's better than more. But
Well, I think if
we
we're
don't have that
having the
answer yet.
discussions with our surgeons and we have to have an implant and it's pure titanium, we do the best we can. But then to even just have the awareness that trace nickel can be a problem for some people. And if you have pain or if you have systemic symptoms or rashes or anything else, let's add an antihistamine. Let's add an H1 and an H2 blocker, and let's try and mitigate those symptoms. And just having the discussion ahead of time, if I would have known ahead of my surgeries that this reactivity was a problem and what I could have done about it when it presented itself, I could have saved years of pain.
From the clip standpoint, there's ways to use sutures instead of clips. Someone like you who's very active, just try not to use them unless you absolutely have to.
Yeah. Do you now, or did you ever think titanium is inert?
Titanium is not inert. It is less reactive than nickel and cobalt and chromium, but it is by no means inert. There are some people who react to titanium. I never thought it was inert. I'm glad because I do spinal surgery that is much less common than the other ones.
You should see the titanium tendon anchor they pulled out of my shoulder. It was supposedly pure inert titanium, according to my surgeon. Came back with rust on it, corrosion, pitting, the whole 9 yards.
People that are allergic to titanium, they react. We've seen that on the
And I'm not allergic to titanium, but my body didn't want that.
Yeah.
Nuts, huh?
Yeah, it's crazy.
In your practice and your facilities, so are you now pre-screening your patients routinely for hypersensitivity prior to surgery? And is this the norm in other practices and facilities? And why or why not?
So it is definitely not the norm. So we're trying to make it be the norm. But in medicine, you always have to look at a few factors. One is the incidence of the problem, the cost of the test, and your alternatives. Like, what can you do with the data? So in joint replacement surgery and in dental surgery, there are good alternatives. There are hypoallergenic implants, zirconium or just nickel-free implants for people that are nickel.
Carbon fiber?
Yeah, carbon fiber. So it just seems like an easy one because the incidence is high because nickel's very high out, and the alternatives are great. So I think those patients should be routinely screened. Now, the joint replacement community will push back and say things like, we don't think it's a problem, but it makes sense. And in your community, I can't believe they would tell someone like you, what, you don't exist. They don't believe that it's a problem. Spinal surgery is different because we don't have great alternatives. The carbon fiber implants you're talking about are rarely used. Their biomechanical properties are not optimal. They're bulkier. So they're, in my opinion, again, going out of opinion, I got to qualify it. I don't think they're as good as the other implants, but when you have to use them, I use them. So I don't screen everybody. I will screen people that know that they're pretty reactive, people that have a lot of allergies, I'll mention it, but I don't screen everybody because if I'm going to start to steer some people to worse implants, I'm worried I'm going to compromise surgical results and it may not be necessary in the bulk of these patients. We don't know we don't know the right answer yet, but I just don't have great alternatives. It's fine. The carbon fiber implants, we use them. I don't love them. I'll be honest with you. They're very thick compared to the other implants. Some people have swallowing issues.
And I had a PEEK problem where I had a non-union with a PEEK cage.
Yeah, and PEEK, the properties of PEEK, it's what's called hydrophobic, so it repels bone growth. It's not as ideal as other implants. So we have to balance it. But we are.
What about the PEKK that I just heard about?
I don't know, PEKK.
Yeah, there's a new one, and I don't even know what it stands for. Don't get me to ask it, but it's called PEKK, and it's yet another one.
Yeah, I'd have to see some data on it, but everything is going to be trade-offs. And they just first tell me why I would be less allergic. I'm not sure. Now, PEEK is less common to be allergic to. Again, I know I'm speaking to you, but
my PEEK was interesting. It had nickel in the X-ray marker rods and spheres, and we think I was reacting to that. Usually,
it's a tantalum bead they'll use, but that bead is nickel contaminated. Frequently, ideally the bead is encased in PEEK, but again, I don't want to pretend like we know more than we do, and I feel like I'm leading that way. It's the Wild West. We're trying to be as careful as we can, balancing. We don't want to be overly sensitive and start compromising surgical results. We don't have to, but we do want to identify the severe responders.
I
The
do
balance
want
is kind of strike.
to, reassure you that we love doctors and we love medicine, and medicine is great. It's really refreshing. We're not looking to you to have every answer, but so often we get a surgeon that's even open to discussing these, that the viewpoint is valid. We don't know what it looks like on the other side of the lens. So just having the input of, yes, we can go here, but we compromise surgical results. These things are helpful for my listeners and followers to hear, and people that will watch this in perpetuity.
And I suspect your listeners are the people that tend to be more allergic. We test a lot because reactors, they tend to react to more than just one thing. Like, it's pretty rare just to say, oh, I only react to titanium, but I don't have any other allergies. Like, usually
Sure.
it's more of a global immune system issue.
Sure.
So that a lot of people don't know that they're a reactor. Like my kids that are not allergic, they would probably need to test for everything because they're pretty reactive to things.
Sure.
I hope if you can get word out, people that know they're reactive will certainly test.
And my position and the position of a lot of my followers is in clinics and surgeons' office and medical facilities, surgery centers. Could it just not be a question on the questionnaire? Have you ever reacted to metal or jewelry? And then if the answer is yes, what do we do with that? There should be a flow chart for that. But the question so many times at the top isn't even asked. And I think that's problematic.
Yeah. And here's to tell you a little anecdote. So a lot of surgeons that will tell me, I'll be at an orthopedic meeting and talking about Sensiband, and surgeons will say, I don't think it's a problem, metal allergies. And I'll say, if a patient comes to you and says they react to their jewelry quite significantly, what will you do? And they go, oh, I won't use nickel on that person. I'm like, so you actually care. You just don't want to scientifically test for it. It's a disconnection. No, it's not a problem. Skin results are not important. Oh, but if they tell me they reacted, I don't use nickel. So it's this mental disconnect that I'm not sure how to explain it, but they'll say they don't think allergies exist except when the patient tells them about them. We're in this weird gray zone, and I think the pendulum is swinging towards people starting to understand this. We're getting close to a threshold. Yeah. Like the big implant companies are starting to talk to us because I think they understand it'd be nice to test people and get better results. If you could say, hey, get a nickel-free implant, because nickel is, again, the number one.
Why are we using it in anything anymore?
Yeah, or get a cobalt-free implant. Like, you'll get a better result. And we have to prove that over time, but that's going to require giant clinical trials. But right now, it just seems so easy to, if you have an implant that's better for that person, why not just use it? It's not like you're compromised. Like I said, it's not like the giant carbon fiber implants. The results are just as good. You're just using a different metal, so they'll be better for those patients.
And I don't expect my surgeons to be God. My spine doc, we're friends. I'm his patient. He's done, 8 surgeries and countless many more pain procedures on me. He was the surgeon for the U.S. ski team, and he was brilliant. And like I said earlier, I asked him before he put metal in my body, I said, hey, I've reacted to jewelry my whole life. Do I need to be worried about what you're putting in? And he said, no. And when I came back in 2021 and we thought that I was reacting to my spinal hardware and I was going to get it removed, he was like, we were just having a friendly chat. He's, oh no, I can't recommend that. I can't recommend that. And I went ahead and did it anyway and came back to him with the results. And when I came back to him with the results, you could literally see the color drain from his face. I reminded him, I said, I told you this a long time ago, and we're friends, so it wasn't an attack. But he's, did we ever patch test you? And I said, no, we didn't. And then he took the bull by the horns and wound up finding that I had a cervical non-union and replacing that at his wonderful, amazing clinic. And he actually said at the end of it, when I was pain-free and it fused and it was just picture perfect surgery, he said, you've really taught me something. Thank you. And coming from a doctor to the U.S. ski team who's had all these national and international accolades, that was really validating for a patient like me because I was starting to be treated and feel like I had Munchausen syndrome. I mean,
yeah, no, 100%. He was just doing what we were taught. We were told it's not a problem. But when I was in medical school and early in my career, we were told to tell people to eat a low-fat diet. And there were all these fat-free foods. But when you take the fat out, you replace it with carbs. So essentially, we're telling everybody, eat a high-carb diet, high glycemic diet, raise your insulin levels. It turned out to not just be wrong, but wrong in the opposite direction. It was actually unhealthy what we were telling them. So medicine evolves. And we were told that metal allergies are an issue, but now we're learning they are. So it's hats off to him for accepting it. We're starting to realize that this is a problem, but we were taught it wasn't. So that's why you'll hear a lot of doctors say, I don't think it's a problem. And we're trying to get past that.
So talking about diet, are you aware that low nickel and cobalt diets are providing really significant relief from pain and symptoms to those who are systemically allergic? And is that anything you talk to your patients about in conjunction with their metal allergy test result? And the same question applies to antihistamines.
In all honesty, when I heard that question, I'm going to research that. I have not been aware of that. That sounds so interesting. It's great. but I don't know anything about it. So
Well,
it's an example where I didn't learn anything about it. I haven't chased it down, but it makes sense, and I want to learn about it.
bring that to the table for your patients, because literally what's the first thing to do when you have inflammation? You go on an anti-inflammatory diet. What are the known anti-inflammatory foods? Nuts, seeds, leafy green vegetables, brown rice, gluten-free grains, beans. Coconut water is really great for electrolytes, and coconut this, coconut that. Guess what? Every single one of those things is off the chart in nickel. And I didn't
It's
start
crazy.
to really get well until I took that stuff out of my diet, changed the stainless steel water bottle, changed the stainless steel cookware. It all adds to the full bucket and the nickel analogy. And I'm in a group of 7,000 plus people right now on a low nickel diet. There's a new cookbook that just came out, and their dyshydrotic eczema didn't clear, their pain, their this, their that, their brain fog didn't clear until they found that connection and went on a low nickel diet. So we're at the cutting edge of that too.
It makes sense. My partner, Dr. Mark Drzala, he is on a very low mercury diet because he was mercury toxic and brain fog, terrible symptoms. He was almost incapacitated. And it was because he was eating quite a bit of tuna. We had the mercury amalgams, but he is now a true believer in a low mercury diet. So it's like you said, the diet matters. I don't know a ton about it. Some candies have titanium dioxide coatings. It's crazy. So I'm going to educate myself on this.
It's not getting put on food. It's actually being taken up from the soil. It's not getting put on food. It's taken.
The candies they're putting on the coating, but you're right. The other foods, it's just being absorbed.
And soy is another big, massive, super high nickel. I'll tell you just a quick story, and my followers know this, but I have an adopted son. I have one child. He's 22 now, and he had been projectile vomiting, throwing up since the day he was born, all the way through high school, through early college. We thought it was soy, but sometimes he'd react depending on the soy. We knew it was soy, but sometimes he was less reactive and sometimes he was more reactive, and we couldn't figure it out. He had all kinds of chronic systemic pain, which you know is not normal for a 22-year-old. I meet with Dr. Scott Schroeder, just a coincidental meeting, and I said, Dr. Schroeder, what is your number one food that lights you up with your nickel allergy? And he said, it's soy. And he said, I can tell within minutes of eating it that I'm going to react. The only person that ever had said that is my son. Ever. He could tell within seconds, literally seconds. He'd taste something and he knew immediately he was going to have a reaction. So I came home and I said, kid, take all these high nickel ingredients out of your diet. And he thinks mom's crazy, cuckoo for Cocoa Puffs at this point, because mom doesn't know anything. I get an email from him 2 days later, and he said, I took the lettuce out of my Chipotle burrito and I didn't throw up. And he literally went on to transfer to a low nickel diet. He ultimately had an orthopedic analysis test. He is systemically allergic to nickel.
Don't get me going on the food allergies, because I have the children that we travel with EpiPens. And it's a separate initiative. If Sensiband becomes big, I'd like to use some of the funding. I just think EpiPens need to be much more available, just like fire extinguishers on the wall. Why doesn't every restaurant have EpiPens on the wall? Or
Sure.
my children went off to college, and they're freshmen, and I have twins. And in college, they said, can the RA give the EpiPen to the child if they're having a reaction? And the school said no. They have to wait for a response. So do you understand time matters? And an anaphylactic reaction, minutes matter a lot.
And
there is no downside to an EpiPen.
No, and we won't go down this rabbit hole.
Heart rate.
Yep. One of my symptoms, I would stand up. My heart rate would go to 160 beats per minute. Standing up, complete POT syndromes from nothing. Oh, you're just anxious. You're stressed. You're tired. I've been anxious, stressed, and tired my whole life, and my heart's never done this. And I'm on beta blockers today because I have a sinus rhythm issue caused by the metal allergy. And I got a bunch of metal that can't come out. And I won't go down this rabbit hole just for the sake of time. But if you haven't looked into it, have you heard of NAET therapy?
No, I don't know that one.
Look at it for your kids, because it is literally taking the anaphylaxis out of peanut allergies.
Really?
NAET. It stands for something. I don't even know what it stands for. It desensitizes the body. It won't take it away, but it takes away the anaphylaxis in so many.
Oh, I will definitely research that. Thank you.
Yeah, for sure. Research that. Okay, so Sensiband is testing external reactions, in your opinion. Does this always predict an internal reaction or just a higher likelihood of an internal reaction?
Again, we don't know. Just like LTT testing, we don't have the data yet. We do know, having dug into the immunology and allergy literature, it is the same immune system, the same T cells. They migrate back and forth. We think it's highly predictive of an internal reaction. The LTT testing, people will say they don't think it's as good. But the allergists do skin patch testing. That is the test they choose to use. And they are allergy experts. They obviously are reading the same literature as me, that the same immune system migrates back and forth. I don't have the perfect answer for you because what is the endpoint of a positive test? Is a positive test somebody who then gets an implant and fails? We don't know. How do you say, is your test positive, false, negative? We need the endpoint. And the only endpoint would be a failure of an implant. So we're trying not to get to that. And so I don't have a perfect answer for you. I can tell you we're just adding some data in me or my family. If I react to my skin, I just don't want that metal put in me unless I absolutely have to. If I'm having a heart attack, I need an implant with stainless because I'm going to die. Yeah, give it to me. But if my skin's reacting to me, I just think I'm going to err on the side of caution. I might go get LTT testing and I might go to an allergist. So if I test positive on my skin to Sensiband, I might, because I'm a scientist, say, hey, I'm also going to go get LTT testing and do skin patch testing. But if those are not positive, I don't think I'm going to say, okay, good, I'll get this metal put in. I just think I'm going to err on the side of caution. But we are doing that study. Dr. Drzala is doing a study comparing those things, our test versus skin patch testing versus LTT. I'll say the issues with LTT testing is sometimes people think it's too positive, it's false positive, and they don't really know. They're like us. They're in the Wild West. If you're testing a lot of metal allergies and certain levels of allergies, we're not sure what to do with that data. Now, if there's an alternative to not use that metal, it just makes intuitive sense to me to then just not use it.
Is Sensiband able then to detect type 4 hypersensitivities?
Yeah, that's what it's checking for. We are exposing your skin to the allergens, and we're looking for a delayed type 4 hypersensitivity reaction. And what we think is nice about Sensiband is you can wear it for a week, or if you're very concerned, wear it for 2 weeks. We're seeing reactions pretty quickly. We're seeing them in 3 to 5 days, but there is some literature suggesting it could take longer. So if you wanted to be super cautious, and your obviously listeners are a very knowledgeable group, they may choose to wear it for longer just to be super cautious. But that's what's nice about it. It's easy to wear. It doesn't bother you. We've had no complaints. The one complaint we had is sometimes it comes off. We're trying to address that. We did the metal thing, which obviously was a compromise. But the next generation, we won't have that. But it's easy to wear. You can swim, and if we have people exercising in them, playing sports in them, no issues.
And the band, this is out of context, but the band is gray and the discs are different colors. Is that correct?
Each disc is molded into a silicone holder, and we made them different colors so you could remember, I would react to the purple one or the green one, just to help people know. The metal is marked on the disc too, but it was just, we felt it'd be nice to have a different color so you knew you were testing different things and what they were.
It states on the website that if a patient tests allergic to an implant already within the body, removal is not recommended, but further implants with the same metal should not be added. Why might it not be advisable, in your opinion, to remove the current implant if it's causing symptoms?
Yeah, so again, that's a high-level question. So Sensiband can be used when you already have implants in, because if you're having a not great result, and you turned out you test positive to one of the metals in there, it's good information to have. You know why you're hurting and not to get more of that metal put in you. Most people don't have the type of reaction you had where it's almost like threatening. Most people just have a negative outcome. They're just having some pain or some swelling, and they can live with that because removing an implant is morbid. It's not a minor thing to do. Each situation is different, and we didn't want to make that medical recommendation or come across like we're saying anyone that tests positive has to have all the metal pulled out of their body. There are people like you that do need that. But most people can live with a knee that's a little achy and it's better than it was before the surgery, but not quite perfect.
I did fine for my first few implants. It's the bucket analogy. So your body can hold some. I've still got a ton of metal in, but I'm relatively healthy again. So how full is the bucket?
We just didn't want to make a medical recommendation. Certainly, if it's very bothersome, speak with your surgeon and they'll balance that away. How risky is it to remove the implant? How much will that compromise the result of what you have of your surgery? Versus how bad is your reaction? If your reaction is terrible, obviously you tip the scales that way. If your reaction is minor and it's very morbid to remove it, it tips you the other way. Taking out a hip replacement is not a minor thing to do. So we certainly didn't want to come across like we're telling people, get all these implants taken out of your body. But it's still nice to know if you had a hip replacement or a knee replacement or a dental implant and it's bothering you, but not killing you, maybe you can live with that one. But if you're going to get more done, wouldn't it be nice to get zirconium or get something that's different so that you're not going to have a bad result for your future implant?
Okay. I have quite a few followers who are having severe reactions to spinal implants. They've tested allergic to the implant metals, and yet their providers are convinced that they don't need to be removed. They're not willing to remove them, even if it's safe to do. And many of them have consulted with multiple providers and had no luck. Would you and your team be willing to consult with them and consider explantation or revision surgeries?
Yeah, certainly. I'm willing to talk to anybody, but it's a complicated decision. And I don't want to mislead them all into thinking like, yes, just take it out, you'll be perfect. because there are other reasons people have poor results from spinal surgery. Spinal surgery in the US is overdone. And I see some patients that have surgery that they shouldn't have had, and so they have a bad result. So undoing a surgery for the wrong reason is not going to make them feel better. So the answer is I would be happy to talk with them. If they're testing positive to metals and things seem to correlate, it's a discussion you can have. How morbid would it be to take it out? One issue is insurance companies don't always approve it, taking out metal because of the metal allergy. Typically do. And if the reaction is bad enough.
I haven't had any trouble on any of mine, and I've had 8. The foreign body removal is just because it's a foreign body, they haven't seemed to give any pushback.
Yeah. We've won every time we've had to fight it. Sometimes it's denied, but we've always, if they truly tested positive, then we've always won. So it is an option, and we'd be happy to talk with these patients, but we do have to have them understand the balance of what's involved with removing it. How risky is that, or how much does that affect the result of the surgery they had? For example, my patient, I took out a functioning disc replacement that was moving and giving them a good motion and switched her to a fusion. And like I said, I was worried that it turned out she had a new cat or something. And so we're happy to have my partner, Dr. Mark Drzala, and I will talk with people, go over things, and we're open to it. It's just they have to understand what they're getting into.
And I will tell you that I found out for me, and I can't prove this is anecdotal, but more than once I have found that in regards to my fusion cages, so 2 in my neck and 1 in my lumbar spine, I was more reactive until the bone fused around the cage, and then I was less reactive. And I can't prove it, but that's what I can tell you is going on inside my body.
Yeah, the biologic environment is different in the inner body region where those are placed. And I think once they fuse, there's less exposure, there's less movement around it. The screws,
less tissue exposure,
other things. There's more absorption, we suspect. Now, I don't know if you deal with Becky Dutton in the UK. She's a metal allergy.
I have a little bit.
Yeah, my partner has a very good relationship with Becky, and she's been wonderful. But she is on top of things like you're saying. She has patients that are reacting, and she has referred patients over to us, and we've taken their metal out, and they've done well. So it's something that can be done, but it requires a significant discussion, review all the imaging, and weighing the risk and benefits.
What surgical options do you have for those who are allergic to multiple metals? And can you do fusions completely without hardware? And if so, what does that look like?
Yeah, if somebody's allergic to multiple metals and can't have metal, we could do a non-instrumented fusion. Now, non-instrumented fusions have a slightly higher rate of non-healing, it's called non-union. There are biologic things we can do to push the scale in the patient's favor. There's molecules we can put in there that induce fusion. So everything, again, is deciding, is it, if their metal allergy is that bad, it's worth giving up 1 or 2% higher rate of non-union and using just a bone graft. Nothing, no metals, no foreign bodies other than the bone graft.
Can that be done without bone cement?
Yes, it's just a bone graft. It's an allograft, which is from a cadaver, but there's no living tissue. It's not rejected. But yeah, there's no bone cement. It's no foreign body. It's just biological tissue. It's a bone graft from somebody else, and that does not involve metal or polyethyl ketone or bone cement or anything else.
Are you using any carbon fiber coated implants in your practice? How common is it, and how common do you think it needs to be?
So the answer is extremely rarely. We've used it a few times in people that are very allergic to metals. As I mentioned earlier, I think they're not quite as good as the other implants. They're bulkier. There's not much data on them. They're much more expensive, though the hospital does not love it. So I think for a very small subset of people, but ideally you probably just want to not use any instrumentation in some of these people or don't have surgery. So a lot of spinal surgery is elective, and if you can get away with other pain management alternatives. But yes, we do use them. We're aware of them. It's just they're not a panacea. They're not just a knee-jerk reaction. Hip and knee replacements, there are very good options. So it is a knee-jerk reaction. Don't use nickel. If you have a nickel allergy, then great. You don't compromise the surgery at all using a nickel-free implant.
Sure. Do you think we need more metal-free alternatives, and what will it take to get there?
I think we do. The metals work for a reason. We're not driving plastic cars. When something is put in the body, it has to last forever. It's cycled, there's wear issues, and the metals have stood the test of time. So most people do great with their implants. So let's be very clear that surgery works. I wouldn't do it. If
I've been clear about that.
If all my patients were mad at me and had bad results, I would retire. Surgery works really well, but there's a subset of people that need different implants. It's going to require some serious engineering improvements to get there. We're still pretty far off is the answer.
Is it sometimes necessary to implant hardware that a patient is allergic to? And if so, what can be done to mitigate the side effects? And when does the benefit outweigh the risk?
Yeah, you're getting beyond my knowledge. So yeah, there are times now, if somebody has a spinal fracture and spinal cord injury, we have to do surgery. We need implants. There may be times where we put something in that they're allergic to and we plan on removing it later. The reason we use a lot of implants in spinal surgery or in any orthopedic surgery, it's a race between the bone healing and the implant failing. If you put screws in, even big titanium screws in somebody's spine, and their fusion does not heal, over time, those implants will fail. Like a paperclip that you just wiggle a little bit will eventually crack. It's a race. But once the fusion has occurred, the implant is actually not necessary. So we can take them out. So in those situations, I would try and do a surgery with the plan that I will remove the implants down the road. I'm not aware of how to mitigate the allergies once they happen, like you were saying, with the low metal diets and the H2 and H1 blockers. I would have an allergist and an immunologist help me.
And just send them to the Heavily Metal podcast where they can find those resources.
Exactly right. So I would have to bring in some outside expertise because it's beyond my understanding of how to best modulate those patients' reactions.
And the Sensiband device can be used after hardware is implanted or only before?
No, definitely after. So ideally before, because you're going to find out ahead of time, it's more commonly used after. Some people already had a hip replacement or knee replacement and they're not having a great result. And as soon as you start asking patients, so many people say, oh, my brother-in-law had a knee replacement. They had to change it. They had to revise it. They said it wasn't infected. That's not a minor thing. So I think there's more reactions out there, like you were alluding to, than people talk about. Not everyone needs to be removed, but if you're not having a great result, why not test and see and say, oh, darn it, cobalt, I'm allergic to cobalt. Anything else I get put in my body, I'm not going to use cobalt in. And that way you don't have to take your hip replacement out, but at least you know, a lot of times you need to get your shoulder done or your other hip.
Or you just need to go on a low nickel diet and some antihistamines to make your quality of life worth living.
100%. And it's like you said, if you put more of it in you, you might tip over the edge and then really, become a problem.
It amazes me. I will tell you, just from my conversations, I find, and this is how not rare I think it is, 50% of the people I come across with chronic pain have reacted to jewelry and have implants. 50%, because it's the first question I ask.
Yeah, isn't that nutty? But then they'll say the skin doesn't matter, or they'll say, I don't think it's a problem. It doesn't make any sense.
Or you get these people with a lifetime of fibromyalgia that have the implants, that have the history of jewelry allergy. You bring this to their attention and they do nothing about it.
Yeah. And fibromyalgia is a diagnosis of exclusion. So some people, they don't have fibromyalgia. They have a metal allergy and they're feeling crappy and having all kinds of, and people are just saying you have fibromyalgia. But the truth is they're just having a normal immunologic response to a foreign body for them.
So what kind of reception are you getting from your peers in practice and surgery centers regarding Sensiband?
We're getting a sort of a mixed response with true believers on one end and to opposite end, people don't want to hear about it. So we're finding there are a number of surgeons that totally get it and they want to test everybody for nickel in particular because they said they have good alternatives. Nickel-free implants are common. But we're seeing some surgeons that just say, hey, this is a great idea, but then they just move forward. They're not implementing it in their practice. And it's like I said, they're just busy. There's just not enough science behind it yet for them to be ready to make a change. They don't want to switch implants that they use. Because what happens if you're a joint replacement surgeon, it's like driving your car. It's dark out and raining and you're in an unusual area. Your car is better for you. You could drive any car, but your car is better. So they're good at one implant. Switching to a nickel-free implant, if they're not used to it, is not as perfect. If something occurs during surgery, they don't know all the bells and whistles and options. So we're finding some inertia that we're getting closer. Like the last meeting we were just at, more and more surgeons are saying, whoa, this makes total sense. And the companies are now starting to say, hey, this is looking interesting, but we haven't reached the tipping point. We definitely have this bimodal distribution of believers and non-believers. In patients, I've spoken about Sensiband thousands of times, and it's 100% people get it. You see that reaction on the skin, and I say, don't worry, we're going to put it in your body. People say it doesn't matter. They go, are you crazy? Don't put that in me. Patients get it. It's just doctors are busy, and they're told that it's not that important, and they just don't want to take the time because it's not a quick conversation.
Does insurance pay for or reimburse for Sensiband?
And not yet. It's going to require some very good studies, just like LTT. So that's why we wanted to make it cheap. $125 for all 7, we felt like is a number that people can afford. We wanted it to be even cheaper, but the medically pure metals are expensive. They have to be pure, so it's not easy to do that. But it's not covered yet. We're hoping as we publish more and more data on this, it will eventually be covered. We'd love it to become the standard of care. As soon as before you get an implant, you just get tested. It makes sense. Now, LTT would also want that. So the question is, which tests? It's going to require a lot of data to see what's the best test from a financial and screening standpoint to do, but it's not covered is the answer.
Got it. So we're getting ready to wrap up, but I have a few closing questions to ask you. Please, can you tell me about some of your patient success stories?
So the biggest one was the patient that had the disc replacement who was really incapacitated, like you. And then I took it out very skeptically. I wasn't fully there yet. I was already starting patent work on, because Sensiband is patented, it required a lot of work. That was like, whoa, she was instantaneous. We took it out and she just immediately was back to herself. And she was really in such a bad way. Other patients, when we've taken the metal out, we've just been very pleasantly surprised with the results. We have not published a big series on it yet, but people come to us and they're having pain of their implants, they're feeling terrible and tested positive to metals. And almost always when we take it out, there's an improvement. So we warn patients. Sometimes it's a home run. More often it's like hitting a triple. They're a lot better, or double. They feel a lot better, but it's not perfect. But usually removing it is not as morbid as they would think. And we've seen some very happy patients from this.
Have you seen somebody that was not a patient of yours that used Sensiband to test prior to or after a surgery, took the test results to the bank, and their provider removed their hardware, their braces, or whatever? Have you had one of those stories that you could share?
I don't have that because they haven't come to me for the removal. They're probably not staying in touch with me as much as you would love. They've known surgeons they're happy with, and they just haven't followed up. We're new. Sensiband has not been out that long, so we don't have a ton of patients with that type of information. Certainly, before removal, you may want to consider getting the LTT test done as well, and go to an allergist and do this formal skin patch testing, and have all three data points, and then make your decision. If you're going to do something as major as take something out. Now, choosing what to put in is easier. You can just steer yourself in the right direction with Sensiband alone. But if you're going to remove, I think it probably is prudent to gather all the data and then decide how bad are your symptoms and how many tests you're positive on, and then make a good decision.
Sure. So tell me what's coming down the pipe in the future for Sensiband.
So Sensiband, we just started our social media marketing. Initially, we thought Sensiband was going to be a purely provider-driven thing, doctors telling patients to get it. But what we're finding is there's a lot of inertia in the provider community, and the patient community understands this. And people nowadays are their own advocates, and they really are much more knowledgeable with the internet than in the past. And we're finding that marketing to patients, making them aware of this, is the way we're starting to go. We're hoping to make the wristband more convenient. We're going to switch to Velcro. I apologize that sometimes it doesn't stay on as well as we wanted to. We're trying to work through that. Some people are very critical in their comments online, but we're doing our best. So we're trying to change the band, make the metal smaller. We're trying to get the data published showing how we match up with skin patch testing and LTT testing. And we just really want more people to know about this because we feel like people can help themselves. It's such an easy thing to do and to get the right implant. We'd like to team up with the Department of Defense, and we're working on that. We're now getting into other countries. We got the CE mark in Europe, which is like FDA registration in the US. Canada is very interested. We have people in Australia and South Korea and Japan that want to start using it. So we're getting interest around the world, even in the Middle East. Now Saudi Arabia, there's a company talking to us. So we're seeing internationally, people are more aware sometimes than in the US about allergies. So there's a lot of things happening. We're trying to meet all these needs and refine the product to make it better and better over time.
I just want to take a minute to thank you on behalf of the metal allergic community. You do have a real job, and being a spine surgeon is no joke. That's a real time-consuming and gratifying and super necessary career path. I thank you for taking the time out of your busy schedule and your busy life to really do this, because it does make a difference. I've said for so long that this is one of the most gratifying jobs. I'm glad I didn't go into medical school. I was going to go become a PA and help manage thyroid. Forget that. I'm getting 3 to 4 emails a week of people saying I saved their life. And I say it's not me, it's a God thing, because my journey just led me to this place where I get to work with doctors and surgeons all day, every day, and patients, and really save lives. I will venture to say this will save as many lives as spine surgery will. And I thank you, because this would be a bit beneath most spine surgeons. And I'm so
I appreciate that. Listen, the more I learn about it, the more and more I realized it was important to do. Initially, it was just a passion project. My partner, Dr. Drzala, is just as involved as me. We didn't realize that this problem is a little bit been covered up almost. It's a little sad, but the more people you talk to, the more stories you hear of severe metal allergies and problems. So
sure.
I'm glad we saw the FDA statement in 2019. It was like we had just received our patents, and we're like, oh my God, this is tailored to us. He's essentially calling for people to try and figure this out.
I know you want more followers and more people to know about Sensiband. So I'll tell you what we'll do. If you will go right now and you will like and follow Sensiband, if you will share the Sensiband page, and if you will share this podcast episode, put your name in the comments, we will put you in a drawing to win a Sensiband kit. And then you can have your own metal test and you'll know all the great things about Sensiband. So that'll help everybody.
Great. Thank you. It's a great idea.
Thanks for tuning in today, everybody. I'm so glad to have our good doc on here to talk to us about Sensiband. These surgeon conversations are so very valuable. I will remind you, we have tons of resources on the page at heavilymetal.com, including the petition that you can sign to urge your providers, your surgery centers, and your doctors to pre-screen patients for metal hypersensitivity. There are tons of great resources that you can follow on there. Please like, share, and comment on the podcast. It helps get our name out there in the algorithm. And thank you again so much for coming on and being part of the movement to tell the medical establishment that we're not going to take this anymore.
Thank you so much for having me.
Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavilymetal.com where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.